Hello, my name is Zoe and I'm going to be your nurse today. How are you?
I'm good.
Can you please tell me your full name and date of birth?
Katie Flaherty, April 9th, 2001.
This is the correct patient. So today I'm going to be performing a focused assessment on you that focuses on perfusion. This exam will take about 5 to 8 minutes, and if you have any questions or pain or discomfort while I'm doing the exam, feel free to stop me. The patient understands the purpose of the exam. Before we begin the exam, can you please empty your bladder and put this gown on that ties in the back?
Okay.
Are you comfortable in the room right now in regards to privacy and warmth?
Yes.
The patient is prepared for the exam and comfortable with her environment. I'm just going to ask you a few questions now. Have you had a history of diabetes, kidney failure, or high blood pressure?
No.
Are you experiencing any shortness of breath, chest palpitations, or chest pain?
No.
Have you noticed any swelling, redness, or changes in your skin in regards to redness, warmth, or noticeable veins in the legs?
No.
And do you have a family history of diabetes, cardiovascular disease, or high blood pressure?
No.
The patient did not report any symptoms, but if the patient did report symptoms, I would follow up the assessment using Olcard's ice and techniques for special circumstances. I've assessed my patient and she is relaxed and her breathing is unlabored. She seems at ease. Her skin color is also pink and appropriate for her ethnicity. I'm now going to take your pulse on your head and neck to test your blood flow. If you have any pain or discomfort while I'm doing this, please just let me know. Can you turn your head a little bit to the side? Thank you. On the other side. Thank you. I palpated the temporal pulses bilaterally, and I palpated the carotid pulse one at a time on each side. Now I'm going to look at your arms, and then I'm going to gently pinch them. The patient's arms are proportional to her body and symmetrical. Her skin is elastic with no tenting noted. I'm now going to use the back of my hands to touch your arms, and then I'm going to examine your nail beds. The patient's arms are pink and warm. Capillary refill is less than 3 seconds. And the nail beds are pink, the nails are pink, and the nail beds are 160 degrees. I'm now going to take your pulses on just 2 different parts of your arms. Her brachial pulses are equal bilaterally with an amplitude of +2. And her radial pulses are equal bilaterally with an amplitude of +2. I'm now going to do the same assessment as I did on your arms to your legs. Her legs appear to be symmetrical and proportional to her body with no edema noted. Just going to use the back of my hands again. Her skin is warm and pink. I'm just going to check your nails again. Her capillary refill is less than 3 seconds. Her posterior tibial pulses are equal bilaterally with an amplitude of +2. And her dorsalis pedis pulses are equal bilaterally with an amplitude of +2. I'm now going to just look at your chest and assess its general appearance. Her chest is symmetrical and there are no abnormal pulsations. I'm now going to use my stethoscope to listen to your apical pulse as well as just other parts of your chest, and I'm going to be focusing on your heart. So the first thing I'm going to check is your apical pulse, which is located at the 5th intercostal space and left midclavicular line. I would assess the apical pulse for 1 minute, and this patient's apical pulse is 65 beats per minute and regular. I'm now going to listen to your carotid arteries, so if you could take a deep breath in and just hold it, please. There were no bruits heard over the carotid arteries. Now I'm just going to listen to your heart with the diaphragm and bell of my stethoscope. S2 is louder than S1 over the aortic and pulmonic valves. S1 and S2 are equal at Erb's point. S1 is louder than S2 over the mitral and tricuspid valves, and there were no murmurs present. Is there anything else you'd like me to know before we finish the assessment?
No.
Thank you.